Welcome to Part 1 of Allied Healthcare Workers Every Recruiter Must Know. This video is for healthcare recruiters aiming for higher revenue by focusing on high-revenue specialties. Not every healthcare professional is a nurse. Ignoring allied healthcare roles means missing major revenue opportunities. I will break down the core allied roles you must understand. Stay until the end. This will change how you submit candidates. Welcome back. I'm Shivani. If you're serious about becoming a high-billing healthcare recruiter, this series is for you. Let's start with the foundation. Segment 1 covers the foundation. What is allied healthcare? It includes medical professionals who are not doctors and not nurses, but are still critical to patient care. They are the roles that keep hospitals running. Allied roles matter for recruiters because of the required certifications, state licenses, and specialty training. Knowledge of these details increases your credibility with clients. Segment 2 focuses on the respiratory therapist, or RT. They manage ventilators, breathing treatments, and critical respiratory patients. There is especially high demand in ICU settings, where they often act as ICU specialists. You must know the two main RT credentials. CRT, or Certified Respiratory Therapist, is entry-level. RRT, or Registered Respiratory Therapist, is preferred by hospitals. Always verify the credential level before submitting. Segment 3 covers the Radiology Tech, or X-ray Tech. They operate X-ray machines and work in the ER, outpatient imaging centers, and hospitals. This is an entry-level imaging role, great for pipeline building. The required certification for a radiology tech is ARRT, the American Registry of Radiologic Technologists. Without ARRT, most hospitals will not consider the candidate. Segment 4 is about the CT Tech, who operates CT scanners. This role is more advanced, involves higher responsibility, and results in higher pay and better bill rates. This is a great revenue role for recruiters. CT Tech credentials require ARRT certification plus a CT specialization. The higher bill rates make this a great revenue opportunity compared to a standard rad tech. Segment 5 is the MRI Tech. They operate MRI machines for magnetic resonance imaging. This is a highly specialized and very technical role, requiring deep expertise in imaging protocols and patient safety. Recruiters must ask about MRI experience. Hospitals prefer candidates with 2 to 3+ years of recent MRI experience, a strong trauma or hospital background, and required certification, which must be verified. Segment 6 is the physical therapist, or PT. They help patients recover mobility after surgery, injury, or stroke. Travel PTs are extremely high demand in rehab facilities and skilled nursing. To practice, physical therapists need a Doctor of Physical Therapy, or DPT, plus an active state license. The travel PT market is a huge, often overlooked opportunity. Segment 7 covers the Occupational Therapist, or OT. They help patients regain daily living skills, like dressing, eating, and functional movement. This differs from physical therapy, as OTs focus on daily living function, not mobility recovery. OT credentials to verify include NBCOT certification and an active state license. Always confirm certification status before submission. Mistakes hurt your credibility. The allied healthcare advantage means these roles are specialized, have high bill rates, and are less saturated than the nursing market. Recruiters who understand credentials submit stronger candidates. The biggest recruiter mistake is submitting without verifying certification, license, and specialty level. Allied roles are detail-heavy, and precision builds trust with hiring managers. Allied healthcare is highly specialized. You must understand credentials before submitting. See you in Part 2, where we will dive into certifications in detail.